Hey, my name is Dr. Chill, and I'm going to be your doctor for today. Welcome to Chill Surgeries. Today, you're here for your yearly medical checkup. This medical checkup is something we like to offer to all our patients on a yearly basis, just to make sure everything is running as it should be, and our patients are in full working order. I have a few questions to ask you before we get into the checkup. These questions are nothing to be worried or frightened about. They're simply just to get an overview, if you will, of yourself and your current medical state, because as far as I'm aware, this is your first time visiting this surgery. Is that correct? Yeah, I didn't think I've seen you before, but like I said, welcome. I hope you enjoy your time here. I mean, it's always a bit of a nerve-wracking experience going to the doctors. I never used to like it, which is quite ironic because I've now become a doctor, of course. So I do like to make everything as soothing and as calming and as relaxing for my patients as possible, just to put you at ease. Yeah, it's what we like to do here. Okay, as I was saying, I have a few questions, some personal questions about your age, name, etc. And then I've got some questions, as I said, about your lifestyle, I guess, to try and gauge if there are any issues there. If you want to answer these questions as honest as you can, that would be great. Just help out the process a lot. Okay, so first question. Please, can I have your name? Okay. Thank you. And can I have your date of birth, please? Yes, so was that the 5th of July 1974? And can I have your current address, please? Yes, where you're living at the moment, if you have a fixed abode. Okay. It's a very nice part of town. Are you new here to the city? Okay, so you just moved here approximately 2 months ago. How are you finding it? Yeah, it's a very nice place to live. Okay. And your postcode, please. Yeah. Great, thank you. Okay, so now we've got those questions out of the way. I have some more kind of in-depth questions, say, about your lifestyle. First one is, I know some of our patients tend to kind of give us an inhonest answer on this one. However, I just, like I said, I really want you to answer these questions as honestly as you can. So, are you a smoker? You are. Okay. Yeah, I used to be a smoker myself, so it's one of those things which is extremely hard to kick. Can I ask how many cigarettes you smoke a day on average? You're going to give me an honest answer there? That was more like it. Yeah, so 10 to 15 cigarettes a day. It's quite a lot. Yes, it's a very addicting habit. Obviously, smoking can have a very negative impact on your general health and well-being, so I highly urge you to try and kick the habits if possible. We have a few classes and one-to-one sessions here in the surgery which can help you on your way to quit smoking. Would you like to sign up to one of those classes? Yeah? Okay, I'll put your name down and we'll contact you afterwards, see if we can get a date for you. Okay, another question, quite similar to the smoking one. Do you drink alcohol? You do. Me too. You need it in this job. Yeah. Can I ask, do you know how many units of alcohol you consume approximately within a week? That's probably about 20 units a week. Yeah, about 20 units. It's not terrible. Again, a bit like smoking, it's something which not necessarily completely kick from your kind of diet, but it would be good to maybe cut down on the alcohol a bit if possible. I know it's hard, believe me. Thank you for answering that question honestly. Okay, so next question. Do you exercise? As in exercise, I mean specifically go out your way to get your heart beating faster than it should be. Yeah, like running, jogging, kind of any kind of physical activity really. Okay, so you go to the gym. That's good. Do you do lots of cardio? I can tell, you're in good shape. Anything else? So you like to go on bike rides? Okay, me too. And you like to jog how many times a week? About 2 times a week. It's very good. I'm very impressed actually. That's a lot of physical exercise which is extremely good for your heart and just general well-being really. It's very easy sometimes to underestimate the power of having a good fitness routine throughout the week. It makes you feel a lot better both physically and mentally as well. Okay, so the next question. Because you've not previously visited us before, we don't have any record of you on file. So this question is one we need to know very honestly. Have you been prescribed or are taking any medication? Okay. Is that prescribed? Okay. It's interesting. Do you take that on a daily basis? Twice a day? Okay, well, yeah, I mean, I wouldn't advise you to take that twice a day or even on a daily basis. It's quite a strong drug. Did a doctor tell you to take that dosage. You see, you really should be listening to your doctor. They know best. So he said 3 times a week. Yeah, that seems a more sensible option for you. Again, I can't force you to take that medication 3 times a week, but I'd highly advise you to just tone it down a bit. Like I said, it's a very strong drug, which can still benefit you at that dosage without any side effects. Okay. And you have paracetamol. No, paracetamol is not a prescription drug, so I wouldn't worry about telling me that. I take a lot myself for headaches and pains when I get them. Okay, and yeah, I think that's about it really. You've answered those questions very well. Oh, no. I need to know your occupation if possible, if you have a job. Okay. Okay. Is that on a building site? Okay. Okay. Thank you for telling me that. It's quite a demanding trade, or demanding job to your body, lifting those kind of weights while working. Can have a negative effect on your posture and your back and your neck and your joints, so please always adhere by the correct manual lifting techniques. Great. Okay, so now this medical checkup is split into 3 sections, 3 relaxing sections, which will help me determine the state of your health and if there's any problems or issues which may need to be looked into a bit further. No, I don't anticipate there being any such problems, but again, it's always good to check, and that's what I'm here for. So, have you been experiencing any kind of problems or issues recently? No? Okay, that's good. Okay, so first off, I'm just going to check your pulse. If you could just take a few deep breaths for me. That's it. Just helps regulate your heartbeat a bit. Okay. 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 Just take this side. Okay. Perfect. Your heartbeat seems absolutely fine, so nothing to worry about there. I'm just going to quickly write that down just so I don't forget. Perfect. Okay, so first section. I'm just going to check your face, your jawline and your throat just to see if I can sense with my hands if there's any lumps or inflammation or anything such like, which may need looking into. Okay, so before I begin, do you give me permission to touch your face and also your mouth as well? It's great. I do have some protective barriers to surgical gloves, should I say. I'm just going to put these on, make sure everything's all clean and hygienic. Okay. Other glove. Let's get in like that. Perfect. These gloves are excellent. They make some really nice sounds. I know it's not a priority right now, but God, they do sound good, don't they? Okay, so if you just want to stay as still as possible, I'm just going to go quickly, just work my way around your face just to see if there's any inconsistencies or anything which may spark a further look. So just working away around your face. Okay. Okay, perfect. Okay, just checking your left side. Okay. Just gonna check your right side now, just to make sure everything is okay. Okay, perfect. Okay, I'm just gonna gently work my way around your jaw. Okay. 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 Very good. If you could just open your mouth as wide as possible, please. I'm just going to have a look at your throat to see if there's any inflammation there, which I'm sure there won't be. Your voice, your face seem absolutely fine, but I'm just going to have a quick look. Okay, wide open, please. Checking your esophagus, just to be sure everything is fine. Okay, perfect. Nothing I can see wrong there. I have seen a very slight bit of inflammation just near your esophagus. However, it's probably nothing to worry about. But I might prescribe you with some antibiotics just to help soothe that for you. Have you been noticing perhaps having a sore throat recently? Okay. Sometimes it takes a bit of a while for it to show up, but I will prescribe you with some antibiotics just to make sure we can get that down for you and it won't become a problem for you, if that's okay. Okay, I'm just going to quickly write that down so I don't forget. Subscribe to just prescribe. Perfect. Okay, so now I don't need these anymore because I will not be touching your face for this section of the exam checkup. Okay, I'm going to put these over here. Okay, so this part of the checkup is to test your vision. Your eyesight is extremely important and can be an indicator sometimes of maybe a underlying illness or disease. You can find out a lot about someone just by looking at their eyes and making sure everything is up to standard. This might be a bit blinding for your eyes. I do have to use this medical light just to have a quick look around. It shouldn't be uncomfortable. However, if you feel any discomfort throughout this, then please let me know and I will stop. Okay? Great. So if I can get up close to you now and just have a quick look around your eyes, if you can try and keep them as wide open as possible, then that would really help me out. Great. Again, just stay still. Make sure this doesn't knock into you. Okay. 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 Okay, perfect. Okay, just trying to check the other eye now. Wide open, sorry. That's it. Okay. Okay. Great. Everything seems absolutely fine now. Okay, the next thing I need you to do is just follow the lights. I'm going to shine the light from a distance into your face while keeping your head still. I just need you to follow the light with your eyes. Cool. Okay, just follow the light, please. Back to the center. to the centre. Up. And down. And down. Okay, just quick fire up, down to the centre. Just follow best you can. Perfect. Okay, just a circle. Round and back. Back to the centre. Great. Again, nothing seems out of the ordinary. Have you ever visited an eye optician before? Maybe something I'd recommend. I mean, it seems fine to me. Your vision seems absolutely great, but I'm not trained in that kind of part of medical thing. I don't know what I'm talking about. Basically, it would be very recommended that you visit an optician just to be sure that your vision and your health of your eyes are as they should be. Cool. Alright, so next test is to test your sense of smell. This test is often done in cranial nerve exams. It's a very good indicator for doctors like myself, just to see how everything is working. It may seem like a bit of an odd test to do, however, it's very beneficial for us to find more about your health. I have a selection of different types of food. All these food types have a very distinct smell. I would imagine you've probably ate either one of these food sources in the last week, so you should be able to grasp what these food types are. Again, try your best. I need you to close your eyes. That's it, just close your eyes. Head up. That's it, just lift your chin up a bit like that. Make sure you keep those eyes closed. I'm going to place the different types of food just under your nose. When I say go, if you want to take a big sniff in and out, and then open your eyes and tell me what you thought the food was. Cool, so close your eyes. I've got the first food type coming to you now. Okay, go. That's it, and open your eyes. What did you think that was? What smell was that? Correct, that was indeed an onion. One of the more easier smells to guess. It has a very distinct smell to it, don't they, onions? Very tasty as well. I like to have them on burgers very often. I shouldn't be telling you that as your doctor, should I? But I do like burgers. And onions. Okay. Next food type. If you want to please just close your eyes like that. Head up. That's it, just up a bit more. That's great. Okay, so the next food type is coming over to you now. It's now below your nose. go. Perfect. So, what was that smell? That was not me farting, by the way. That was someone else in the next room, just so we're aware. Good. So what was that smell you just smelled there? Orange. Correct. Do you eat many fruit and vegetables during the day? Do you get your 5 a day? You do. It's very recommended. Personally, I'm not a dietitian, but I find vegetables more beneficial for your health rather than fruits, because fruits, they have a lot of natural occurring sugars, which are not a bad thing. However, if you were to eat, say, 5 oranges a day, then you're having a lot of sugar, which could make you gain weight, and also it's not great for your teeth either. So it's something to think about. When having your 5 a day, try and incorporate as many vegetables as you can. Carrots, cucumbers, well, the list goes on. Definitely a bit of advice I would give you there. Great. Okay, so got the next food type in my hand. If you want to just close your eyes again, please, and chin up. Next food type coming to you now. Just placing it under your nose. Okay, go. Okay, so eyes open. What did you think that was? It was a banana. Correct, Amondo. That's 3 out of 3. It's very impressive. So that test shows me that your sense of smell is, it's 3 out of 3. It's great. It's not a necessary test. It's something which a lot of doctors tend to forget about, but I find it very important. And getting 3 out of 3 is always good as well. So that is today's yearly medical checkup done, completed. How did you find your experience today? Okay, not bad. If you had to give me a rating out of 10 in terms of the service I provided you today, what would it be? 6. 6 out of 10. Alright. You sure? Only 6? And just a 6. Okay. I'm not going to write that down actually, but thanks for answering anyway. Before you go, can I just take your contact number just so we can contact you about that smoking class, quit smoking class we've signed you up for? Okay, so 12486 529. Okay, Mr. House. It's very good seeing you today. Say everything seems absolutely fine, so I'll see you again in another year. Yeah, see ya. Bye.